But whereas robotic surgery, this is fixed, this doesn't move, fulcrum, and part of the instrument which is like wrist like it is moving, so there is less tissue trauma to the abdomen. So our patients of like even after complex surgery, they are sitting up in 4-5 hours, they are walking. By seeing our patients, they are now coming and they are demanding robotic surgery even for a simple procedure like cholecystectomy.
Hello and warm welcome to Sucess podcast series, where we bring you insightful conversation with leading experts in medical field. Hi, I'm your host, Dr. Smarika Bhatt, and today I'm honored to have a podcast interview with Dr. Shrikant Kurhade with us. Dr. Shrikant Kurhade is a distinguished laparoscopic robotic and GI surgeon from Pune. With over a decade of experience and leadership role at KK Multi-Speciality Hospital and KK Care Hospital, Pune.
Yeah, I'm also excited to be part of this podcast.
Without further ado, we'll start with our first question with Dr. Shrikant Kurhade with us. Extensive experience in GI surgery. How do you compare the robotic surgeries with GI normal procedures?
Okay, so I started my laparoscopic surgery career very long back in 2007, and I'm performing laparoscopic surgery till now. Robotic surgery being the recent introduction, robotic surgery is recently introduced in India in big way, and last couple of years I am doing robotically as well, all procedure robotically. So what is the major difference is, there are distinct advantages of robotic surgery over laparoscopy. First thing is like what vision we get in laparoscopy is 2D, and even 3D laparoscopy systems are there, but they are not true 3D. They are like we have to wear goggles and then on screen we get to see 3D. But in robotic surgery, when we sit on the console and we get a true binocular 3-dimensional vision. So depth perception is more. Then it is 10 times magnified, and clarity is much better than laparoscopy. So once we see the better, once we have better visibility, our precision increases. Then second distinct advantage is laparoscopy instruments, they have certain degree of movements, like they can open and close, they can rotate, they can go up and down. Okay. Whereas if you compare robotic instruments, they have got 7 degrees of freedom. What are 7 degrees of freedom? Like it can move like wrist leg, it can rotate. So that gives us flexibility in performing complex procedure. Another point is when I am performing, I am laparoscopic surgeon, I trained myself to be bidextrous. So I can do with both hands. But every surgeon may not be bidextrous. But when you are doing robotically, we control both movements with our on console with our fingers. So with same precision, any surgeon can do effectively. So even ordinary surgeon can become bidextrous with robotically. So these are distinct advantages over the laparoscopy.
Okay, that was a fantastic answer. So let's move on to the next question. We talk about the learning curve. So how difficult it is, or they talk about how it is challenging to turn into a robotic surgeon. So what's your take on it?
So what I feel laparoscopic surgery really takes good amount of time to be expert. But if you are doing laparoscopic surgery for a longer period, then learning robotic surgery was easy for us. And what happens, there are various robotic technology or various robotic platforms. So they have got robust pre-clinical training programs. Like we will be doing a lot of console training where we'll be artificial intelligence enabled modules are there, which enables us to master the hand movements on robotic. Then I did a structured fellowship for 1 year where I was involved in cadaver program. Then we were asked to visit the Center of Excellence, and where we assisted many procedures. And after that we completed our fellowship exam after duly giving theory exams and viva exams. So that structured fellowship really helped me to take the expertise. But as compared to laparoscopy, learning robotic surgery is much easier.
Okay, so that was perfectly explained about the differences. So let's move on to the next phase. As you are a GI surgeon, so what kind of benefits you get out of from robotic surgery? What kind of procedures you get help from?
This is very perfect and apt questions, because there is a dilemma in medical community always, because there is a little bit extra cost involved in robotic surgery. So always medical fraternity is comparing like what are the advantages, then only we should offer to the patient. So what I feel currently we can do all the GI procedures robotically, but there are certain procedures where I feel there is a distinct advantage, where there is a lot of suturing is involved. So we are trained over the period of times, and similarly we can do laparoscopically suturing as well. But if like surgeon who is not well versed with laparoscopy and is struggling, robotic will definitely help surgeon to do the suturing easily robotically. So in that procedure, I think robot has definitely robotic surgery should be preferred in certain cases. Okay. Simple procedure like cholecystectomy and appendicectomy or simple hernias. So I don't feel there is any role right now. But patients are demanding, and if they are affording, we are offering. But from heart, if we say, then I think robotic surgery should be reserved only for complex cancer surgeries or complex GI surgery.
So as you have touched upon the cost part of this surgery, so as we know that Indian healthcare system doesn't really support this robotic surgery to every institute, or if not every Indian doctors want to pursue this surgery. But if you want to tell the audience about the significance of robotic surgery, how you will justify the robotic surgery cost?
Yeah, so that is the dilemma, because when we talk about robotic system, the dominant robotic system or the best possible robotic system right now, what we are using is Da Vinci. And there is a disposable. The instruments cannot be used beyond certain use. So one instrument we can use only for maximum 10 cases. So we have to dispose it after that. So there is a definitely cost difference. Patient has to pay around 1.5 to 1.75 lakh rupees extra for the robotic surgery. So definitely, when the complex procedures, like cancer surgeries, like when patients are being required, or where precision is required, for that, or complex hernia, where like either which are difficult to do laparoscopically, or if you are trying to do it laparoscopically, there is a chances of converting it to open is high. In that case, robotic surgery is definitely helpful. But what happens generally whenever some surgeon is coming into the robotic training program or robotic surgery program, he is advised to do simple procedure first. So if you see that some surgeons who, for the uploading patients, they are offering cholecystectomies or hernia for their learning curve, and for that some certain advantage to the patient as well if patient is uploading. But as you progress, most of the surgeons generally they are offering for Indian patients for cancer surgeries, complex GI surgeries, complex or big hernias, and bariatric surgery. Definitely in that case there is a role.
So the benefits, or you can say the results of robotic surgeries are justified with the cost. Means their success rate is good as compared to the normal procedures.
Yes, there are definitely distinct advantages. Initially, when I started, I was also bothered about the cost and all that. But if you see the outcome of the patient, patient can get up, like it is very, I was surprised, because laparoscopy also we do with small holes, and robotic surgery is also done with a small hole. But there is a distinct advantages with pain score and patient mobility. Okay. What happens, like suppose this is abdominal wall and there is hole. So laparoscopic instrument move here. So that causes some trauma and some pain. But whereas robotic surgery, this is fixed, this doesn't move, fulcrum. And part of the instrument, which is like wrist like it is moving. So there is less tissue trauma to the abdomen. So our patients are like, even after complex surgery, they are sitting up in 4-5 hours, they are walking. So it is definitely advantageous if patient is affording, or if it is covered by insurances, health insurance.
Okay, so the recovery rate is faster.
Faster, patient pain scores, and patient generally now what I am experiencing, even if there is no insurance cover, patients are coming and they are opting for robotic surgery after paying huge money, like whatever difference, patients are opting because they are seeing result of other patients. So there is some segment which is fearful for the pain and complication of surgery, and which is not ready to undergo surgery. By seeing our patients, they are now coming and they are demanding robotic surgery even for a simple procedure like cholecystectomy. So last month I operated my auntie who is sitting on with a problem of gallstones for last 4-5 years, and she was scared. But when she had interaction with one of my patients who was cancer patient, and she got recovery very faster, she came to me and she said she wants robotic surgery. So definitely patients are demanding, and there is a future for robotic surgery in India.
Okay, so thank you, Dr. Shrikant. That was really very insightful regarding the robotic surgery. So we'll move on to the next question is, as a lot of patients come to you, so do you do any specific kind of technical modification for different kind of patients in robotic surgeries?
Yeah, so generally, so that is the training part. Generally, what holes we make in laparoscopy, they are different than the robotic surgery. So robotic surgery, port position is very important, and that is what we require training for. Rest part is easy. So we need to plan the surgery. There are certain, generally what happens, laparoscopy, we can go near the organ and put ports, but generally robotic instruments are longer. So we have to make sure that we are at least 18 to 20 centimeter away from the target organ. So we have to make certain modifications in the OT environment also. Patient position is different. Anesthesia implications are different. And generally what happens, laparoscopic surgery, my assistant is with me and I am doing surgery and he is holding camera. When we sit on robotic surgery, we are sitting on the console, we are away from the patient. So we require a very expert team in robotic surgery who is equally capable like a primary surgeon and who will be on patient side. So generally we perform as a team. So we have got 3 people in our team, and one will be on patient side and one will be on sitting on the console. So generally, if I am sitting on the console, person with the similar expertise will be on patient side. So that is another advantage. Like generally what happens, if any surgeon is doing, one surgeon is superior and one is assistant will be operating. In robotic surgery, 2 capable surgeons are there in the OR. So that increases the safety double.
So as we go with previous background of all your experiences, so I have seen that ICG fluorescence imaging you have done in the past. So so in what ways that ICG fluorescence has helped in the procedures?
So ICG fluorescence has helped tremendously for us. Like ICG we are using very commonly in robotic surgery. Like gallbladder surgeries we give 2 hours prior, so that when we put ICG mode on, we can see the bile duct clearly. So we keep away from the bile duct when we are cholecystectomy. If we are doing any surgery, if we give 1 minute prior ICG, we can see the all arterial blood system. So we can keep away from the vessels when we are dissecting. In cancer surgeries particularly, when there is a resection of the intestine involved, before reconstruction, we can give the contrast and we see whether it is vascular or not. So that has we have got certain scientific papers also on that, and we have whatever research has seen, almost 30% of the patients when we have used ICG, the decision has changed. Vascularity is not good, so we can revise and put. So definitely with ICG, safety has increased. Another use in when we are doing pelvic surgery, we can put ICG contrast in the ureter. And so when we are dissecting, we can see the ureter nicely when we are doing fluorescence guided surgery, and we can protect the structure. So basically ICG helps us to identify the normal structures away from the disease. So injury to the normal structures like vascular injuries or ureter injuries or even pelvic nerves, like when we are doing robotic pelvic surgeries, the pelvic nerve we can identify better. So if we preserve them, the bladder function and sexual functions is preserved in the patient. So basically quality of life of the patient post surgery will be much better with the robotic surgery.
Okay. Thank you so much for joining in today. Those answers were really insightful for our audience. I'm sure our audience will have a good benefit out of it. And thank you to our viewers for tuning in. And remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate us to join on Medicina's platform. Medicina's platform is not just a resource, it's a dynamic space where you can connect with your medical peers or participate in meaningful discussions and contribute to the ongoing evolution of healthcare. So until next time, take care.